Thank you.
We started streaming. Thank you.
Thanks, Amanda. Good afternoon, councillors, officers, members of the public and press. Welcome to this meeting of the Outbreak Control Board engagement group even. It is a remote meeting, obviously, and it's being live streamed and recorded to the council's website. I'll now hand over to the Democratic Services team, who will do a roll call.
Thank you, Chair. As indicated, we'll begin the meeting by way of a roll call of all those in attendance remotely. May I request members to confirm they have a paper copy of the agenda and can both hear and see each other in the meeting. I'll now begin the roll call with Councillor Moore as present as Chair.
Yeah.
And Councillor Thomas.
Yes, present.
Thank you. Councillor Harrison.
Yes, I'm here with the agenda.
Thank you. Denise McGuckin.
Yes, I'm present and have the papers.
Thank you. Dr. Tim Butler. I don't think Dr. Butler's joined us yet. No. Michael Houghton.
Hi, yeah, I can hear and see everyone and I've got the papers as well, thanks.
Thank you. Leslie Wharton. No, come back to Leslie. Craig Blunderwood.
Yes, I got the papers and I can see and hear everyone.
Thank you. Sally Robinson. No. I've got Pete Graham representing Sharon Cooney from the police.
Yes, I'm here and I have the papers, thank you.
Thank you. Jill Harrison.
Yes, here Amanda and have the papers.
Thank you. Tony Hanson.
Thanks, Amanda. Yes, here and got the papers.
Thank you. Ed Turner.
Thanks, Amanda. Yes, here with papers and I can see everybody.
Thank you. Christopher Akers-Belcher from Health Watch. No. Julian Penton.
Yeah, present with papers and everyone visible.
Thank you. And I've got Michelle Delves. No. And Jackie Mackenzie. Dr. Mackenzie. No. That concludes the roll call. Is there anybody present who I haven't shouted out on my roll call? No. Okay, I'll hand back over to the chair. Thank you.
Thank you, Amanda. Are there any apologies for absence for those who weren't on the roll call? No? Okay. Right, we'll just move on to agenda item 2 then, just to look at the minutes for the last meeting that was held on the 5th of October. Is everybody happy with those minutes? Is there anything, any questions or comments on there that anybody would like to raise at this point? Okay, we take that then as a true record then. Thank you very much. And move on to item 3, which is coronavirus in Hartlepool, a data update by, is that Craig and Dean who are going to be bringing this in?
Yeah, great, thanks. Just trying to get off mute there. Thank you for that. Yes, just going to give you a brief overview of where we're up to currently with the COVID data and what that means for Hartlepool. Can we have the next slide, Joan, please? Feel a bit like Boris Johnson now. Possibly. Great, thanks. As you can see from the graph, and as I'm sure you'll be aware, in general, the number of cases has started to rise quite significantly as we headed into autumn and through to the start of winter. You can see from that graph there that the blue line represents the line at the top is Hartlepool data, and the orange line at the bottom is England data. So the rate per 100,000 population there has increased quite significantly since the end of September, and I think we were always anticipated that was likely to be the case as we headed through into the winter season. And again, I think you can see that that actually indicates that we are tracking, as we have done for quite a significant amount of time during the pandemic, at a higher rate per 100,000 than the England figures as well. Can we have the next slide, please? So these show the weekly COVID cases up until the 6th of November, with the graph at the top illustrating England and the graph at the bottom Hartlepool. Very similar picture to both, but you can see there very clearly the increase in cases there for Hartlepool. And I think just to give you some of the latest figures, as of the 9th of November, our total number of cases are around about 2,758, which is 2,945 per 100,000 population. And our latest 7-day count is 378 cases, which gives us an overall rate per 100,000 of 404, which is concerning because that is one of the highest rates we've actually seen. So obviously, again, it's increasing quite significantly at the moment. We did see in the last few weeks that the data, we were thinking that the figures had started to plateau. However, we are starting to see those rise again. One of the concerning things is I had a quick look at the most up-to-date data prior to coming onto this meeting that we've got for the rest of the region. And it actually looks like it's not just us where we're seeing that increase in cases, but it's happening across the whole of the northeast as well, which I think is a bit disappointing, unfortunately, as we were seeing the plateauing as we were going through the last few weeks. With the next slide, please. So this gives us the rolling averages. Again, England on the top, the 7-day and 14-day rolling averages, 7-day in blue and 14-day in orange. Again, we use rolling averages to smooth out some of the peaks and troughs in the data because of the way the data's reported on. And again, it does show you that there is that consistent increase from the end of August as we go through with the 7-day and 14-day averages, and that's happening across the board. But again, that illustrates that it's increasing quite significantly. You can see a little bit with the blue line on the 7-day graph for Hartlepool. It's that towards the end, sort of that plateau, but again, starting to increase again. So it does just illustrate just where we actually are. And I think one of the challenges we've got with the data at the moment is you'll probably remember, or you may remember from previous presentations we've given, that we were starting to see it quite significantly in the sort of younger age group from around about 15 to 24, which was driving the cases. But what we're actually starting to see now, it has started to move through the population, and we're starting to see increasing numbers of cases within the older population as well. So it has actually started, whilst it's sort of initially towards the end of August, around about that time was predominantly or quite high numbers in the younger age groups. We are now starting to see it spread a bit more wider throughout the population. Can we have the next slide, please? Again, death rates listed here. That gives the total deaths over the course of the pandemic there, with Hartlepool at the top and England the bottom line there, which shows us our rate per 100,000 population is higher than the England average at the moment. We've started to see a few more deaths appearing in the data over the last few weeks. And again, it's worth bearing in mind that while the cases now are starting to increase, any mortality and deaths are a lagging indicator, so that they will occur a few weeks after any increases. So if we are going to see increases, they will occur a bit further down the line. Obviously, it is concerning that we still have quite a higher death rate in total, and we hope that it won't increase significantly. But as we start to see increases in the numbers of cases, that gets more likely. Can we have the next slide, please? So this is the latest heat map that we've produced based on the numbers of cases. So the darker areas show a higher number of cases across Hartlepool. So as you can see, they are concentrated in, as you would expect, the main areas of population. There's a particular spot in the north of the borough, as you can see there, around Hart, which I think is something to look at in terms of the high number of cases. Again, there are quite a high population there. And again, going back to outlining it, as it moves through the population, we are starting to see, as I said before, those higher numbers moving into different age groups. And I think we're sort of clear at the moment that there is ongoing community transmission. We are obviously looking at the data as and when it comes in to try and identify certain clusters or outbreaks that may be occurring, and we are able to pick those up and look at mitigating measures. But I think it is fair to say in general that actually we have reached the point where there is general transmission happening anyway in the population. We are obviously in the middle of the latest national lockdown. I'm hoping that we would at least start to see the data plateauing from where we are. Obviously at this point in time, with the incubation period being anything up to 2 weeks for the virus, it's too soon to start seeing an effect of any of the measures that have been put in place. But we would anticipate, that any impacts would start to be seen in the latter part of the lockdown period. But again, I think it obviously demonstrates the data that it is looking to starting to increase again from when we were plateauing, which is a slight concern and worrying. But again, I think it reinforces the fact that we all need to continue to follow the sort of hands, face mask, space guidance, and make sure that we sort of are all abiding by any of the restrictions that are in place. And particularly, if people are symptomatic, they get tested and that they do isolate, follow the isolation rules, and again, maintain that compliance, because I think that is going to be the only way we get these numbers down. Thank you very much. I don't know if Dean, if there's anything you'd like to add in terms of the data.
Just that the heat map, the area of high concentration in and around the border between the Hart wards and the Bruce wards, that's something that in the early part of the COVID period, we didn't see. There wasn't that high concentration up there. The concentration was much further down in the town.
Thank you. And can I just, while we've got him here, just put on record my thanks, Dean, for all the work that you're doing in the background, pulling all this together. You're kind of one of the unsung heroes of all this, because we do become a bit reliant on waiting for your updates. I've got Councillor Thomas.
Thank you, Chair. And just a couple of questions, Craig. And firstly, you've talked about this heat spot in the sort of the Bruce Hart border. Is there any indications as to what is driving that? Is it anything around schools in the area? Is it around certain clusters of households? Is there any indication as to why that is the case in that particular area? As clearly both Brenda and I have a particular interest in that part of the town.
We do follow up the cases because we have actually got access to line lists and know where the positive cases are and where they're coming from. So we do that work to try and identify that. I think for that particular area, there hasn't been anything that's leapt out at us that there are key problems there. I mean, what you are seeing is that in households, and we know this, is that there could be 2 or 3 households in an area, and you'll see the virus going through members of each household, which again sort of isn't unexpected. So it could just be that it's related to a higher number of households and that have sort of got the infection, and then that household, if it's got a high number of people within it, will obviously experience cases in there. So there's nothing. We do keep a regular eye. We regularly monitor the data we get, just to pick up any particular hotspots or anything like that might occur. But there is nothing at the moment, I don't think, that we've specifically identified there.
Thank you. And second point, moving on from your presentation, is certainly in the early days of the pandemic, we were seeing very high levels of COVID within care settings. And are we seeing anything similar in the second spike that we're seeing now? And if so, how are those infections again being driven? And sort of like linked into that, are we seeing any significant levels of infection amongst vulnerable adults in in the general community of the town, as we have a lot of people in Hartlepool with underlying health problems, some very significant health inequalities within the town, and clearly there's a lot of evidence coming through that those people are particularly vulnerable to COVID. So are we seeing anything coming through amongst in both of those areas?
I think you're on mute, Craig. And I think Jill Harrison was going to come in to answer one of those points after you. No. Is your actual headset muted? Not the on the computer, is your headset muted?
Can you hear me now?
Yeah.
Excellent. Something was, but I don't know what it was. Okay, sorry, I've just completely lost my track there. Care homes, yes, we are seeing cases in care homes, and there are an increasing number at the moment. One of the things I think to say about that is we are seeing increased testing at the moment, because we do have regular staff and resident testing, so that's clearly going to pick up cases, and we are seeing an increase in the number of cases that are being picked up from asymptomatic staff as well, which I think is different to what we were seeing early on in the pandemic. And I think it is positive that we are identifying those people, because we can intervene reasonably quickly. But yes, the answer is we are starting to see that now, and looking at outbreaks in homes. But again, I think we are have better systems to deal with that now, and to identify that now because of that additional testing. In terms of that, the second part of your question, yes, we are aware and clear that obviously it does affect people with sort of who are more vulnerable and have underlying conditions, and I think we are starting to see at the moment a slow increase of people being admitted to hospital with COVID-related conditions, and starting to see people becoming ventilated as well. Clearly not at the numbers yet that were at the height of the previous spike, but it is concerning that we are starting to see people come through now. I think it's probably what we would have expected as we headed towards winter. It's not a surprise, but obviously we need to work on those preventive measures to ensure that it doesn't get worse.
Jill, were you wanting to come in off the back of that?
Yeah, it was just to give an update on the numbers in care homes. So we currently have outbreaks, an outbreak being 2 or more cases in 14 care settings, adult care settings in the town. That's 8 care homes for older people, and also a small number of smaller care homes and extra care settings. So it is a concern in terms of the numbers. The pattern's slightly different to last time, in that we're seeing far more staff test positive this time. As Craig's outlined, obviously that's partly due to the fact that staff are now routinely being tested, but we suspect that's also linked to the community transmission more than it was in the previous wave. So we are seeing increased numbers. We've just had another outbreak confirmed in the last day or two that's affected 15 residents in a single care home and 4 staff. So obviously that's a significant concern. I suppose just to reassure members, we are doing lots of learning from outbreaks, and if lessons are learned, we're sharing them with all of the care homes. Myself and Craig are doing a weekly update to all care providers over the winter period, and that gives us an opportunity to share that learning, to put reminders out there about appropriate use of PPE, some of the areas that staff need to focus on, and also an opportunity to make sure that all of our providers are up to date with all of the latest guidance, and to give reminders about the importance of flu vaccine and things like that. So we are still in that very regular communication with care homes, and there has been some really good learning from the outbreaks that we've had to date, and we continue to support the homes, obviously, with the outbreak plans. So it's not a great picture at the present time, but the positive is we're not seeing the numbers of deaths that we did in the first wave, but obviously continue to monitor that really closely.
Thank you, Jill. Brenda? Oh,
yeah,
sorry.
thank.
I'll bring you
Sorry?
back in a second, Stephen, if that's all right.
Yeah.
Brenda?
So sorry. Actually, it's very much based on the question that Stephen first asked, which we obviously put our hands up at the same time for, to do with the reason, and maybe Dean would be able to answer this, the reason for the fact that there's a higher percentage within the area you suggested that wasn't there before. I mean, I know assumption is not something that we should be doing, but I can't see that the schools going back in September en masse as they did is not a contributory factor to that. There's a lot of schools in that area. I understand that 140 kids at the moment are isolating from High Tunstall. That area actually does go into High Tunstall School. And I would suspect that what you said yesterday, Craig, about the dance schools and then going into school and so on. So although I appreciate that you can't actually say for sure, is there any way that we can say when this rise started, for example, Dean? You know, did it start before the schools went back, or did it start after the schools went back? Is there any indication of that at all?
So the slide specifically was only focused on the last 2 weeks of data, and it's something that I've been having a look at today, that specific period, and there does seem to be quite a large number of households where it appears the full household has been infected, for want of a better term, which does seem to have raised the numbers in that specific geographical area in a way that it hasn't in others. That does seem to be one of the factors, but the wider period, the period from I suppose the end of August when figures started going up, is something that again we'll be focusing on heavily to see if we can see what is driving both geographically and externally the areas of high concentration.
Right. Okay. Thank you. I just think that we need to be. Right. Sorry, am I echoing? I've got an echo. I just think we need to be very careful as to and vigilant. You know, as we are in the care homes, and I know schools are doing everything they can. This is absolutely no criticism of them. I just think they need more support in order to do things a little differently, maybe, and to actually still give the kids their education, still have that kind of social contact, but maybe not quite as full on as it is. And you know, we've heard about these are not my words, but the blended rotating learning. And I'm not suggesting that we do it exactly as it has been suggested, but I think some kind of, particularly within the secondary schools, because you've got lots of children, lots of households there all together. They can't stay in a bubble. It's ridiculous. Those bubbles popped as soon as they went back into school. And, you know, I do think that schools are struggling to maintain the sort of guidance that they've been given and to maintain the safety, really. So I think they need a lot of support.
Thanks, Brenda. Stephen, have we lost Stephen? Yeah. No, looks like we've lost Councillor Thomas. Yeah. Okay, was there any other question? Denise?
It was just, Chair, I just received an email from Councillor Christopher Eckers-Belcher. He's trying to get in on the call, so he should be with us soon. He's had some IT issues.
Okay, thank you. Okay, thanks very much. If there are no other questions or comments for Craig on the data update, we'll move on to the next one, which is a joint one by both Denise and myself. Do you want to go first, Denise?
Go on then, yeah. It was just, thank you, Chair. It was just to bring the engagement board up to speed with where we were over the last 4 weeks. It doesn't feel like 4 weeks. It feels like some days a lot less and some days a lot more, if I'm honest. So prior to the 3rd of October, our cases were high, as you know, and on the 3rd of October, we went into what was known then as an area of intervention and then became labelled Tier 2. And then I think it was about the 14th of October, Shane, where the other 3 local authorities came into Tier 2 as well, or were placed in Tier 2. Then the week before the national lockdown, we were meeting, Shane and I were meeting the Chief Medical Officer, his deputies and Secretary of State Robert Jenrick and officers to look at what they wanted. They wanted to move the whole of the Tees Valley into Tier 3. As Craig explained in his previous presentation, that we were in a position at the time, along with Middlesbrough, that we were starting to see the cases plateau and flatten. They weren't decreasing, but they weren't increasing either. And we were negotiating to try and keep Hartlepool and Middlesbrough into Tier 2. The Secretary of State wanted to follow the Chief Medical Officer's advice and put us all into Tier 3. So we spent a lengthy week, a very complex week, including the weekend, working on negotiations to ensure that we had the best financial support for our businesses and to enable us to do the test and tracing that we needed for Hartlepool. And at the same time, restrictions that would keep everybody safe and interventions. And even up until the Sunday evening, prior to the Prime Minister's announcement that we were going into lockdown, we were still working on that. So the point, I suppose, of what I'm trying to let the engagement board know is we were working really hard on the negotiations for everybody in Hartlepool, but we were part of a Tees Valley conversation. We now went literally into lockdown, and the previous week was almost just a blink of an eye, and I don't know why we bothered, Shane, to be honest. But that's the world we live in. The worry I'm slightly concerned about now is I was hoping that, and I'm still hopeful, that when we come out of the national lockdown, we'll be back in Tier 2. If our figures keep continuing to increase, as Craig has just mentioned, and they're very, very early days, then we might be placed automatically in Tier 3. So as a board, we really need to be getting the message out to people and working collectively together about, how important social distancing is. I feel that people think if they wear a mask, that's enough, and they have to do all 3. It's, wash your hands, and I know I'm preaching to the converted here, but I think that was the point I wanted to make. I know Shane might want to make something a bit more political, but as an officer, I shall leave it there. I'm happy to answer any questions, Chair.
No, I won't make any political. I think I've done enough of that, and it isn't quite appropriate for this meeting today. The purpose of this working group is to ensure we have a joint up approach in getting the message out there and trying to get some compliance and keeping the public on side with us. So I don't think it is appropriate for me to be too overly political at this point in time. Denise, you raised the main point that I wanted to get across today, and that is that we need to use this time extremely wisely. We do need to get compliance, people complying with the current set of regulations. We do need them to do everything they possibly can to get cases under control and to bring them down during this lockdown period, because the last thing we want is for at the end of all of this to exit a national lockdown into Tier 3, because for most people they won't feel like much difference, and for many businesses it will be devastating for them, especially in the run up to Christmas. So that's my ask today, really, is that we all play our collective part in trying to bring down the rising cases, get people to remember the simple rules, but also, and don't get me wrong, I know it's going to be difficult, and it's going to be difficult because people did knuckle down and people did try hard over the past month, and we saw that reflected in the data. And I guess by potentially being dragged into tier 3 because other areas hadn't done as well, we're in a difficult position now, because the public will think, well, we've tried hard, but others haven't, so what's the point? But there's a really significant point, because if we don't bother to do it, and then we are going to get dragged into tier 3. Well, that's about it, really. So please just work with us. Contact Ed if you need any help. Contact Craig. We'll be more than happy to share as much information as we can to try and use this time wisely. I've got Stephen, your hand up.
Thank you, Chair. And I would certainly echo everything that you have just said there. And I think we are entering a potentially quite difficult time. And there is the run up to Christmas. But yesterday we had a glimmer of light at the end of the tunnel with the announcement that there could be a vaccine coming into circulation by the end of the year or early next year. And I would really just make a plea to people that there is that temptation, given that little bit of light at the end of the tunnel, to lower your guard just a little bit, to not be quite as vigilant with social distancing and the other measures that you've just been through, Shane. But it is so important that that doesn't happen, because I think what we've seen is that given the slightest relaxation of vigilance on the part of people, then the virus does start to go on the increase again. And I think that in the run-up to hopefully having that glimmer of light of the vaccine in the next month or so, it's going to be quite a long run-in to it going into mass circulation. So I think that there is still some way to go before we really do have the virus under control. And I think while the vaccine is still coming through, while it is initially just being targeted at some of the most vulnerable and at-risk people and health and care providers, it really is so important that we all do continue to observe the measures that you have outlined in what you said earlier. So I really would make that plea to people that, yeah, it's great that we have got that news, but please stay vigilant.
Thank you, Stephen. Denise?
Yeah, thank you, Chair. Stephen's raised one of the points I was going to raise. The other point was, what I find very powerful when I watch the national news is the health providers who usually have a doctor or a nurse doing a video. And I know Ed's working with the North Tees and Hartlepool Hospital Trust to look at that. And it would just be really helpful if our health colleagues could really help, because it's all right sending an officer and me putting a video out, but you know, me sat in my sweatshirt's not really going to make much difference. But put a doctor up there in his uniform, it really helps get that message across. And it was just a plea really to our colleagues in the health organisations to work with Ed and ourselves, and we'll do whatever we can to get those messages out to the community.
Thanks, Denise. Were there any questions from anybody? No, looks like we got off lightly, Denise. Next point then is another update. Initially, this was down as a presentation, but Craig's just going to give a verbal update on this agenda item instead.
Yeah, thanks, Chair. Can you hear me? I haven't had any problems with my microphone this time. Excellent. Yeah, this is just, I think in previous meetings we discussed the proposal to look at health champions, and I think again it probably follows on really logically from all of these points we've been raising today about the importance of getting messaging out there, but also about, I think, community engagement and engaging with our population, just so that we can really strengthen the message and you know, bring people along with us rather than you know, imparting messages from on high. I think we've done quite a lot of work with various different agencies around the town to try and develop this piece of work, and I know there's also been some work that's been going on with our community street ambassadors as well to link into this. So we're in the process of setting up a broader community champions offer, to really sort of, as I say, look at how we build on the existing community relations we've got and work with the existing community organisations to get this messaging out there. So I think it's still early days at the moment, and I think really the update was to say that we're actually pulling together a formal proposal which we're going to bring, which we'll bring back to the next meeting to look at, because we are still in the process of working with partners and identifying the best way to deliver this. But I think again there is funding out there to support this. But also, I think the purpose for flagging it at the moment is to ask those people who we haven't sort of engaged with yet to consider working with us on this, because I think realistically, given the fact that we have this increase in cases and we really do need to bring people along with us. And again, I'd reiterate the comments that were made previously about the news about the vaccine, is that we are still in this for a lot longer than the end of the year. And I think we need to be really underlining that and really getting that message out into our communities and supporting people as well, because I mean part of this will be to enhance support for people who are looking at having positive tests and having to self-isolate. So I think it's really just to update that we're working on this proposal. We've been working with Julian in Hartlepool as well as a key partner to look at this. And just to let you know that we are pretty well coming together to bring a paper to the next meeting based on the work that's been done in the last few weeks.
Thank you, Craig. Any questions or comments from anybody? Stephen?
Thank you, Chair. It's just to ask what sort of response have we had so far in identifying community champions?
At the moment, we've been working on the structure and looking at really working with the organisations that will help us to do that. So we haven't actually got to the point of identifying any community champions as such at the moment. We are just working on, we've been sort of collating information from other areas and looking at what certainly particularly different authorities in the northeast have been doing about setting this up, and looking at the different proposals to see what would work with us. But at this point, we haven't gone out to recruit or anything like that.
Can I just, off the back of that, Craig, when do you expect for that to happen? Because if you're not, well, we're not a decision-making body, are we? So it's not like you're bringing a paper here for the 11th of December for us to sign off on it, because I would hate that to be the case anyway. It would be a month wasted. So just
absolutely,
if you have an idea of a time frame, that would be helpful.
We are looking to progress it, as you say, very quickly. We haven't got an exact time frame, I don't think, yet for setting it up, but we certainly won't be waiting until December to put it into place. We hopefully, I think Joan and I will be bringing a paper to the CMT, I think, on probably early next week to look at approval for that. So it is going to be reasonably quick.
Great, thank you. Anything else from any of the members? No. Okay, thank you. There are no other items of no other business, sorry, that I have. Was there anything anybody else wanted to raise at this point? Councillor Thomas. You're muted.
Sorry about that. Just in my role as mental health champion, I suppose it's to Jill Harrison, and what sort of trends are we seeing in mental health issues coming through in this second spike that we're going through at the moment? I know that in the early days of lockdown, we probably didn't experience any major increases until we were quite well into the first lockdown. Then we started to see a spike in demand for mental health services. But how are things panning out this time round?
I haven't had any update in terms of the activity this time. I understand there is an update coming to the Health and Wellbeing Board in a couple of weeks' time around the increase in activity that's been experienced across the board. We are conscious that this time round there may be an increased demand on the support hub from people from a mental health perspective. There'll be a different emphasis this time because the government guidance is very clear that there are different methods in place for people to access food and prescriptions. So we are conscious that there may be an increase in mental health activity through the support hub. Obviously, that's only just been sort of stood back up again in full over the last few days. So it's something that we'll be monitoring, and we can certainly bring an update to a future meeting.
Thank you.
Okay. Thank you very much. And that's it then. Thank you all very much for your time and your engagement today. As I said earlier, if you need anything, sorry to put it on you guys, but if you need anything, just get in touch with us, especially Ed and or Craig, and I'm sure we'll do everything we can to help out. Thanks very much. Next meeting is the 11th of December. Look after yourselves and see you then, if not before.
Thanks, Shane.